think the features that make EAHP stand out are those that encourage pharmacists to develop their research into a publication. I want to see it as a journal that hospital pharmacists really want to read. So when it arrives, the first thing they want to do is open it, which may sound like a strange thing, but many journals remain unopened. I think the evidence-based medicine approach is beginning to make a big difference, and hospital pharmacists are beginning to see that they need to think differently from the way in which they've done in the past. I think evidence-based medicine is really important in today's practice. Essentially, no government can afford to buy all the medicines that its population thinks that they could have. So choices have to be made based on best evidence. Now, within hospital pharmacy for many years, we've had lots of anecdotal treatments, people that have thought that such a particular drug works, whereas we now know that it probably doesn't. And we know that some drugs do more harm than good. So therefore, evidence-based medicine is an approach to try and understand which drugs do more good than harm, which drugs do more harm than good, and those drugs that we still don't know whether they do good or harm. As I look at the work that hospital pharmacists have done over many years, they do really high quality research. Compared to their medical colleagues who always publish, pharmacists have rarely published. And so hospital pharmacy is not considered to be such an academic profession as medicine. And I think we need to change that culture. I've taken an initiative to say that I personally will support a first-time author. And I invite them to email me and to say that they've never published before, and to send me a copy of the manuscript that they are working on, even if it's only partly written. And then I work with them to get it to a position where I feel confident that we can publish it. The EAHP publishes first online, so if they want to see what's coming and they want to see what is available, then they should look online. But I see EAHP as part of where hospital pharmacists need to look, and they need to be aware of the wider literature as well, and particularly using the medical literature to keep themselves updated.